Hi, I'm Jack Cush with Room Now, reporting from Room Now, meaning my office at home. I'm going to report on abstract 0952, the recipe study. This was authored by Pooja Khanna and colleagues. This is an interesting trial of pegloticase use wherein mycophenolate was used to inhibit or abrogate the anti-drug or anti-PEG antibody response, which sometimes screws up the long-term outcomes in patients treated with pegloticase for refractory gout. So this title was Reducing Immunogenicity of Pegloticase in patients with refractory gout. This was a phase 2 trial, double-blind randomized trial where patients received either mycophenolate or placebo prior to and during treatment with pegloticase. They screened or enrolled 42 patients. They treated 32 who had received at least one dose of pegloticase. The primary endpoint were those who achieved a clinical response with a serum uric acid less than 6 at week 24. That was achieved by 68% of people on mycophenolate and 30% of placebo, so it was a success. The toxicity or side effects with mycophenolate was relatively little. So this is the first novel trial, the first novel use of mycophenolate in patients also receiving pegloticase. You know, we've had a few studies, uncontrolled reports using azathioprine and maybe methotrexate. We've had a few, 10 patient cohort studies, and actually there's another cohort study of methotrexate use while using pegloticase. This is novel in that it uses mycophenolate, which seems to be really well tolerated and gave a good outcome, especially with the primary endpoint being 68% of patients normalizing their uric acid. This is, I think, an important report. We're going to see this presented, I think, on Saturday. I'd look forward to it. That's it. Tune in for more videos on Room Now.